I am a doctor, a robotic surgeon. Meeting women with various gynecological complaints in my OPD is part of my job. Women from every age and stage of life would consult me with irregular periods, painful heavy bleeding, postmenopausal bleeding, or inability to conceive. After thorough investigations and examination, sometimes the diagnosis is multiple fibroids or tumors in the uterus, a big cyst in the ovary, or extensive endometriosis. And sometimes it may require surgery, and that scares the patient. They start imagining a long cut on their belly, blood loss, pain, and inability to work, move, or sit comfortably post surgery. We start planning our calendar, figuring out when would be the best time to go for surgery after completing our important tasks at work and at home. We start calculating our leave days, needing to take rest post surgery. Or we would call our mom, our sister, or request our husbands to please take time off to take care of us post surgery. Or sometimes we would just delay the surgery in fear of this pain and inability to work efficiently, drive, or travel post surgery. But what if I tell you that we operate on patients with extensive endometriosis or multiple fibroid uterus or many other gynecological ailments in the morning, and by evening patient is walking to washroom by her own after having a light meal. She doesn't even know where the scar is because there is no pain or no discomfort. And she's ready, changed in her home clothes, ready to go home by evening. Yes, and there is no need for antibiotics or pain medication. This is possible. With the robotic surgery, with advancements in medicine, this outcome is reality. I'm Dr. Aruna Kalra. I'm a robotic surgeon and consultant OBGYN. Robotic surgery is a boon for patients who need surgery for any gynecological ailment. But 20 years back, when I was doing my residency, my senior professors were quite traditional in their approach to embrace the technology, to medical advancement. They thought the transverse incision, 5 to 6 centimeter transverse incision, was progressive as compared to a vertical incision given on abdominal cavity. They were apprehensive that transverse incision would not give them adequate exposure, leading to struggle during surgery because our two hands needed to go inside the abdominal cavity to tuck the 6-meter long intestine in a towel to keep it away from surgical field so that we can perform surgery easily. Sometimes 2 or 3 surgeons would go inside the abdominal cavity to perform the surgery. Yes, intestines took long time to recover from this rough handling. And it was painful, there was immobility, pain, and patient was not able to function properly. Those days, patients were staying in the hospital for 7 days, and mobility and meals started only after 3 days of surgery. So much has changed from then. Robotic surgery is a boon, but many patients mistakenly believe that robotic surgery involves a human-sized robot physically cutting on them. In reality, it is just a machine, and surgeons operate on this machine and perform the surgical steps. So, the leap, the robotic surgery. What is robotic surgery? Let me tell you a story. I can remember a young patient in her 20s. I was seeing her for many years. She was affected by endometriosis and she was very apprehensive. What is endometriosis? Endometriosis is when your menstrual blood starts collecting in your pelvic cavity and bleeding starts in ovaries, urinary bladder, intestines, and everywhere on every organ in the pelvis. She was experiencing excruciating pain during periods. The pain was throughout her month. She was having chronic pelvic pain while peeing and pooping. But she was apprehensive of surgery. She needed complete dissection of every endometriotic implant, eroding her internal organs. But she was clear. She said that she does not want robot to be involved in her surgery because she was apprehensive. She thought that robot would be performing her surgery and she was more comfortable with me than with robot. I had to explain it to her that it is not the robot, it is just a system holding very efficient robotic arms, the instruments, 3D camera, which is operated by a surgeon. Nonetheless, the explanation she was convinced with, and I operated on her using the system, clearing each and every endometriotic implant from her pelvic organs and gave her a pain-free life afterwards. Today, she is thankful for her decision. I vividly recall another patient, a beautiful lady from Saudi Arabia. She presented with history of repeated preterm labors or miscarriages in her 4th or 5th month. She was pregnant 6 times before, but every time her weak womb could not hold her pregnancy till term. Every time she delivered an anatomically healthy baby, around 400 to 600 gram, but they could not survive because of extreme prematurity. Her womb was weak and multiple times suture was placed to hold her pregnancy till term, but to no avail. On examination, her cervix was torn in multiple pieces. In fact, there was no cervical tissue left to hold her pregnancy or to do any kind of corrective surgery. The appropriate treatment for her was to place a purse string abdominal cerclage. Abdominal cerclage is a difficult surgery. You have to save blood supply to the uterus and ureter, the urine pipe, which is going very near to the point. With utmost perfection, under the highly magnified view of robotic camera, the suture was placed high up on the womb and it was smooth and successful surgery. She could go till term this time, and I'm pleased to share with you that she has delivered a 2.9 kg healthy daughter just a month ago. And her suture is holding strong, allowing her the possibility of having many more children in future. So as I said, that robotic surgery is a boon. And with the advent of minimally invasive instruments, we go inside the abdominal cavity through 1 centimeter incision, and carbon dioxide gas displaces the intestine on one side, giving us a clear panoramic view of internal organs. Initially, we were using laparoscopic instruments with limited two directional mobility, and camera control also depended on OT assistant. But now, with the advent of robotic surgery, the game has changed again. In robotic surgery, instead of standing besides the patient, surgeon sits on a console and it is away from OT table. And with master hand control and foot pedal, surgeon performs surgical steps. Robotic camera has 10x multiplied vision, so magnification is very clear. It feels like as if you are diving into the tissue, seeing every blood vessel, nerve, or tissue fiber through the camera. And that is why the outcome is remarkable. There is virtually no blood loss, not even 5 ml. And surgery is absolutely pain-free. Patient does not know where the scar is, and there is no need of antibiotics or pain medication after the surgery. This is like a video game. And at the age of 50, I thought it would be really challenging for me to learn this new technique. On the other hand, my male colleagues, with their swift reflexes and their childhood gaming experience, would surpass me. And I would be obsolete, just like my senior professors. But I knew that by reinventing myself, by adapting to every new turn life was taking, I can thrive, I can learn. So with childlike energy and interest, I jumped into the arena with only one goal in my mind: perfection in surgery. I practiced and practiced till I was confident. I was the first one from our institute to complete the TR100 training at a record pace. Continuous learning is important, is vital. Now, when I see an extensive disease on MRI, I don't feel helpless or sad for patient. I feel powerful. I know that with this system, I can completely dissect the disease and remove the disease from her system, giving her good future. She'll be able to conceive by her own, and she'll be able to lead a pain-free, productive life. So learning never stops. You should always have a childlike enthusiasm to learn, play, and grow. I kept reinventing myself. I kept unlearning and learning. Whatever your age or stage or experience in life, you should be open to the idea of learning, because it is vital for reinventing yourself, for being relevant in this world who is evolving rapidly, and you should embrace the change. You should embrace the change. You should be passionate. You should be adaptable to change, and you should be dedicated to evolving with every new chapter of life and ready to face its sudden twists and turns.